teeth sensitivity, what causes teeth sensitivity, what are the different reasons why our teeth can be sensitive is what we look into this video, because it's a very commonly asked question when patients come to us or in our subscribers when they ask in the comment section below. They say that they are not able to enjoy an ice cream with their children, or sometimes they say even a regular water can cause a lot of sensitive teeth, or hot coffee or hot tea, they are not able to have it. So in this particular video, let's address what are the causes of teeth sensitivity and what can be done to prevent those teeth sensitivity. We'll be looking at into another video. Hello all, this is Dr. Arun from Pearls Dentistry, running our dental centers at Chennai, Raja, Namalipuram since year 2001. If you have not subscribed to our channel, please do subscribe to our channel Pearls Dentistry. We've got a whole bunch of videos coming out on dental health and awareness. So when it comes to teeth sensitivity, what we need to understand is our teeth is covered by enamel. It's one of the hardest structures in our human body, right? It's a really hard substance. And the enamel does not have any nerve endings. But inside enamel, there is dentine, which has got something called dentinal tubules. There is a lot of fluid movement that happens in the dental tubules. And inside the tubules, we've got the pulp, which has the nerve of the tooth. So when our tooth generally are not supposed to be sensitive to either extremes of temperature, be it hot or be it cold. Generally our tooth is not sensitive because it's covered by enamel. It can withstand quite a difference in the temperature. Unless otherwise it's extremely hot, which can burn our tongue or burn our gums, or it's extremely cold, like biting on an ice can usually cause sensitivity. Otherwise generally they're not supposed to be sensitive for an ice cream or to have a hot cup of coffee or tea. When it is sensitive, it means that there is something that's happening which is compromised the enamel, which is compromising the dentine, which is leading to the sensitivity. So now let's look into those reasons. So when it comes to those reasons, one of the most commonest reasons is tooth wear. So what do we mean by tooth wear? Simple terms, as I said, there is enamel, dentine and pulp inside. There is something that's happening which is causing wearing of this enamel structure. So this wear of enamel structure and the subsequent dentine structure can happen in different areas of our teeth and different areas of our mouth. So now let's look into those aspects of it. The first commonest wear is a mechanical wear. So what do I mean by mechanical wear? Usually it's by faulty tooth brushing. Either using too much force or too hard a brush, or too much time, too much frequency, too many times that we brush our teeth. So when you use faulty brushing, there is mechanical wear of tooth structure. The outside surface, which we call the labial surface or the buccal surface, which the surface when you look into the mirror or when you smile, the tooth surface that is seen is the labial surface, right? So that surface wears off. So when that surface wears off, it typically causes like a notch-like defect at where the tooth comes out from the gums. So now this wear is a mechanical wear because we are mechanically brushing our teeth away, brushing the enamel away. So this wear can cause tooth sensitivity. This is one kind of wear. The next kind of wear is on the chewing surface of a tooth. So what do I mean? On the chewing surface of the tooth, the wear typically happens because of excessive grinding. Some people will have an habit of clenching the teeth. Some people will have a habit of night grinding. It's also called bruxism, right? So this excessive grinding of teeth or excessive clenching of teeth can wear the enamel structure on the surface. So how will a typical tooth looks? A normal tooth will have those elevations and depressions. They are called those cusps and fissures. So when the wear that happens, these cusps can get flattened out. The tooth can get flattened out, can lead to pitting on the surface of the tooth. It look like so exposing the dentinal surfaces. So these teeth can be sensitive. So this is a occlusal wear, which is called alteration. There is a third type of wear. The third type of wear typically happens on the inner surface of the teeth, which is a lingual surface or the palatal surface of the teeth. So this wear typically happens because of chemical wear. So what do we mean by chemical wear? It can be because of all the cola drinks that we have, which are very acidic in nature. Now these drinks, when there are certain people who have a tendency to consume this very frequently or taken it for a long time. So these can pool around the surface of the teeth, resulting in, because of the high acidic nature of these cola drinks, can resulting in a chemical wear of the tooth structure. It can also be seen in certain people who take too much of tea, which is very alkaline in nature. So it's the opposite, but it gives you the tooth will look as if it's completely polished and glazed. A highly polished glazed surface, worn out surface. It can also lead to sensitivity. or some people will have a reflux disease, a gastroesophageal reflux disease or GERD, or they might have a tendency, there are some cases where a frequent vomiting may be an issue. So now in those instances, stomach acids can come up through our throat to the mouth, can resulting in wearing of enamel structure. So these all causes chemical wear, which is an erosion. So we have seen three kinds of wear, which is attrition, which is the occlusal surface, which is then the abrasion, which is on the buccal surface, and then the erosion, which is on the inside surface. So these are some of the commonest cause of tooth wear and sensitive tooth. The next common cause we should understand is tooth decay. Because in tooth decay, what happens? The enamel structure and the underlying dentine structure gets compromised. So no longer the enamel gives protection from sensitivity. No longer the dentine is able to protect us from the hot or cold. So because of this, a decayed tooth can cause sensitivity. The difference between wearing of tooth causing sensitivity and decayed is, decayed tooth typically happens on one or two spots where the decay is there. Because of wear, the sensitivity can be more generalized. So we need to, this will help to an extent differentiate between a sensitivity due to decayed teeth and sensitivity due to wearing of tooth structure. So these are some of the two commonest causes which we discuss now. The third commonest cause is usually a gum disease. What do I mean by gum disease? We need to get our teeth cleaned once in 6 months. A professional scaling is very important. And say there is a lot of plaque deposit, there is a lot of calculus deposits on our gums. So this results in a lot of inflammation of the gums. This inflamed gums can cause the gums to, because their gums are swollen up, they don't longer hold to the root surface of the tooth quite strong. Because they don't hold close to the root surface of the tooth. So there is a space that happens between the gum and the root surface. A space happening between the gum and the root surface, anything hot or cold can cause sensitivity. So this can also lead to a gum recession. So gum recession also can receding gums can also cause teeth sensitivity. So these are some of the commonest cause of teeth sensitivity which are more oriented from the tooth aspect and the gum aspect. Some non-common aspects are, for example, somebody having a sinus infection. Sinus infection can mimic as if there is tooth sensitivity in the upper teeth. People who are having some a joint disturbance, which have clenching the teeth, can also mimic as if it's a tooth sensitivity. Or a cracked tooth can also cause sensitivity. Or sometimes a filled tooth can also cause sensitivity. These are some of the non-commonest causes which will help us to identify why the tooth is sensitive. So hope we have addressed most of the issues that can result in sensitive tooth. If there are any questions, please do ask in the comment section below. We'll be happy to answer. Until next time, this is Dr. Arun from Pearls Industry. Bye bye and thank you.